Hello, everyone. Today, we will talk about the skin infection or the three common skin infections. A skin infection occurs when parasites, fungi, or germs such as bacteria penetrate the skin and spread. The first common skin infection is cellulitis. Cellulitis is an infection of the dermis and subcutaneous tissue that has poorly demarcated borders and is usually caused by Streptococcus or Staphylococcus species. It usually affects the arms and legs, and it can also develop around eyes and mouth. It's usually caused when bacteria enter a wound or area where there is no skin. The signs and symptoms. In general, cellulitis appears as a red, swollen, and painful area of skin that is warm and tender to the touch. Cellulitis treatment usually includes a prescription oral antibiotic. Within 3 days of starting an antibiotic, let your doctor know whether the infection is responding to treatment. You'll need to take the antibiotic for as long as the doctor directs. Prevention of cellulitis. Cellulitis cannot always be prevented, but the risk of developing cellulitis can be minimized by avoiding injury to the skin, maintaining good hygiene, and by managing skin conditions like teria and eczema. A common cause of infection to the skin is via the fingernails. The second common infection was the impetigo. Impetigo is a common and highly contagious skin infection that mainly affects infants and young children. It can also lead to lifting of the stratum corneum, resulting in the commonly seen volus effect. The most common cause of impetigo is bacteria called Staphylococcus aureus. These bacteria lurk everywhere. The most common way for your child to get impetigo is when they have contact with someone who has the infection, such as playing contact sports like wrestling. The first sign of impetigo are reddish sores on the skin, often clustered around the nose and lips. These sores quickly grow into blister, O's, and burst, and then form a yellowish crust. The, the cluster of blister may expand to cover more of the skin. Sometimes the red spot just develop a yellowish crust without any blister being seen. Impetigo can be uncomfortable. Occasionally, it may involve a fever or swollen glands in the area of the outbreak. Treatment. Antibiotics are effective against impetigo. The type of antibiotic you get depends on how widespread or severe the lesions are. Just like cellulitis, appropriate personal hygiene and frequent body and hand and hair washing with soap and clean running water is important to help prevent impetigo. The last and most common skin infection is folliculitis. Folliculitis is a common skin disorder involving the inflammation of hair follicles. It is typically due to an infection and results in irritated pimple like spots or pustules. When the infection is bacterial rather than the mechanical in nature, it is most commonly caused by Staphylococcus. If the infection of the follicle is deeper and involves more follicles, it moves into the furuncle and carvicle stage and usually requires incisions and drainage. Infection by Staphylococcus aureus bacteria, yeast, fungus, and viruses can all cause folliculitis. Other causes include skin irritation, topical steroids, some medication, occlusion or blockage of the follicle, skin disorders such as acne or dermatitis, irritant chemicals. Symptoms: follicles are small tube-like in the epidermis in which individual hairs grow. They are present on all parts of the skin except the lips, palm of the hands, and soles of the feet. Symptoms include itching or tender bumps, crusty sores, itching, pain, pus-filled sores, inflamed skin, and tenderness. Here are the tips to help prevent folliculitis. Wash skin before waxing or shaving. Use a shave cream or coconut oil and always use a sharp blade. Avoid tight clothing to reduce friction. Change clothing after exercise to keep moisture from the skin. Stay cool and dry. Wear breathable clothing. Use hot tubs and heated pools with caution. Practice good general hygiene and choose natural skincare products. In the event you scar from folliculitis, choose natural scar remedies. Doctors can treat severe folliculitis with a prescription strength antifungal or antibiotics ointment. And that would be all. Thank you.